Amongst Northern Carolina, the heart of innovation, passion, and culture lays a promising future for the progress of medicine. The elixir of life lies within us, in the form of our health.
Public health remains a prominent factor for concern in North Carolina. According to a 2023 survey, 68% of North Carolina adults have experienced at least one healthcare affordability burden in the last year. Additionally, 85% of those adults worry about affording healthcare in the future. This crisis can impact anyone. A family member, a friend, a teacher, or even your close neighbor can all fall victim to lack of proper healthcare.
At this time, most public health informatives target hygiene rather than addressing actual concerns in society.
With something so drastic that could potentially falter the progress of our society, much attention is needed.
More often than not, this decline in public health is attributed to the lack of inclusivity in terms of patient needs.
People suffering from chronic illnesses, mental health, and other medical extremities struggle to reach out for medical assistance either due to accessibility or financial concerns.
ASCLEPS, derived from the Greek god's name Asclepius, the Greek god of health and medicine. In turn, ASCLEPS remains a revolutionary factor in aiding the future of public health.
Allowing users to seek assistance in the proximity of their homes ensures that more people who need help can attain it.
This is our introduction page where you can give in some basic information and create your login. You can agree to our terms and conditions. And once you sign up, you'll be presented with our homepage where you can see some basic resources. You can go to your healthcare section to see nearby healthcare and your appointments, and go to settings to change your login. After this, when you click the logo, you will be treated with our main feature of the app, which is to log your symptoms and get a report. You will be able to log your symptoms for specific parts of your body and dates for when you started experiencing them, upon which you will be treated with an extensive report on what you should do, your symptoms, and the approximate cost it will take to treat this. Then you can log out.
In order to understand the root of the crisis, we conducted months of research, which included talking to medical professionals, community members, and patients to help gain better insight.
This app caters to any and everyone. Children, however, may have some trouble using the app, so a parent or guardian can monitor it for them.
ASCLEPS remains an innovative solution to the current modern-day public health crisis. ASCLEPS doesn't only allow users to gain more insight on the medical world, but it also helps to foster relationships between one another. And these relationships can not only help build connections, but they can also help users to understand the medical world at a deeper depth.
A skill that we honed during our time developing the app as a group of friends was communication. We were able to connect and build something together as a team. While also enjoying the process, we faced several difficulties, but were able to solve it and come out on top in the end.
We've all grown individually on many different things, but collectively, we've all gained and refined important ones. The biggest thing RSA taught us was the importance of time management. Through our research, we learned more about the community we lived in and its issues that we, as members of this competition, found commonly in data, yet they were without solutions.
In terms of team development, we struggled, not just with the schematics of this app, but also with communicating with one another. Time management, in turn, was a really big problem. Getting our conflicting schedules to line up with one another was really difficult, and it also caused us to fluctuate in terms of our innovation and our inspiration for the app itself. Understanding and empathizing with one another, that sometimes the most efficient way to work isn't always together at the same time, helped us to better create this app in a more time-effective way.
As a team, we had to figure out how to fit time to work on our RSA app so we could communicate throughout our process. This translated to how we adapted our project deadline to better fit our schedule so we can solve issues that we had. We utilized diverse perspectives by creating a team from different countries and ethnicities. Our app tied into the various struggles in life that we know others face. Health is something that we understand is a universal problem, especially in the state of our economy today.
Overall, we were able to grow as a team as well as a group of friends. Our varied skill sets allowed us to tackle many different problems from different viewpoints to find the best solution. Traversing through the many hardships we encountered, from conceptualization to implementation, only strengthened our bonds with each other and our wish to make a positive impact with our app.
ASCLEPS.
Prioritize your
and your bank account's health.